Welcome to Gold Coast Insider, where we bring you business insights, stories, opportunities, and forecasts from movers and shakers across the Gold Coast. I'm your host, Estella Rodiguero. I'm CEO of Regional Development Australia Gold Coast. It's my pleasure to introduce and welcome Dr. Laetitia De Villiers. Dr. De Villiers, a specialist interventional neuro-radiologist, completed advanced training in Mount Sinai Medical Center in New York before returning to Australia in 2010. Letitia is one of the co-founders of Qscan Radiology Clinics and was the first female partner, contributing to its growth to over 85 clinics across Australia. Letitia, together with her colleague Dr. Hal Rice, have made the Gold Coast University Hospital a global hub for cutting-edge treatments, attracting international businesses and industry for research and development. Letitia was the first woman to perform a robotics-assisted endovascular treatment of a brain aneurysm. She has co-hosted the World Federation of Interventional and Therapeutic Neuro-Radiology 13th World Congress on the Gold Coast in 2015 and is the co-founder of NeuTex, a training centre for surgical and robotics innovation. Letitia is also the Gold Coast Woman in Business of the Year for 2023. Welcome, Letitia.
Thank you very much. And thank you so much for having me on your podcast. It's lovely to be here.
Thank you. Now, you grew up in South Africa. So let's start there. What inspired you to pursue a career in the medical field?
I often think about this and wonder if there was any particular turning point that pushed me towards doing medicine. I always thought I was going to do medicine, even from a very young age. And I do know my parents used to read me a lot of stories about amazing doctors in various specialties that would go out and treat patients in areas that really needed them, and across the world did amazing work. And I think maybe that influenced me along the way. I'm not sure, but I always had this idea, even when I was a young child, probably from primary school, that I was going to do medicine, and I actually never considered doing anything else.
That's amazing. Actually, you're quite lucky because you actually had that vision that you knew what you wanted and you knew what you needed to do to get to that point as well, didn't you? So that was quite fortunate.
I think so in a way, but also I didn't really even explore any other ideas at the time. But what was good is, I didn't actually know what specialty I was going to go into in medicine, and also that I would be branching out into business and research in other areas as well, which has obviously broadened it a lot.
So you left South Africa and you continued your medical journey. Can you tell us what that journey looked like and how it eventually led you to right here on the Gold Coast?
Yeah, well, I did a few years of medicine in South Africa before I left. And yes, South Africa was an amazing place to train because we had so much experience and we had so much variety in conditions that we saw. So, it is a very violent country. So we saw a lot of trauma. So you learn to cope at a very young, as a young doctor with large volumes of really severe injuries. And we also had times where we would have, a lot of people that were struggling with really diseases that we don't see much in a more developed country. So I got exposed to a vast range of, from treating something like TB meningitis in a child to, patient coming in with multiple stab wounds or burn wounds. And it gave me a really good grounding. And I think a lot of people were not as lucky, or I was not as lucky in their career. I actually did have a really wide variety of different types of specialties in medicine that I saw before I left South Africa. And when I left South Africa, I was not really planning to emigrate forever. I was just going to travel around a bit and work in some other places and see what it was like. And the first place I went to was the UK. And I enjoyed working in England, and I had experience working in both the private sector and the national health system. But England, I think, was, it's not my people in that. I had to struggle with the weather. That was probably my first issue. But I honestly loved working there. And I was actually about to return to South Africa when a friend of mine said, "Oh, I'm going to Australia for a year to do a locum. Why don't you think about doing it?" And that's when I came to Australia for the first time, and I landed up on the Sunshine Coast just for a year. And I really loved living here so much. I loved the people, I loved the lifestyle, and I really enjoyed the work I was doing. And so that was when I actually made the decision to emigrate from South Africa.
At that stage, what field of medicine were you practicing?
That stage, I was doing a lot of emergency medicine, and my experience was, I'd had quite a lot of experience in emergency medicine, but I was also doing general physician and cardiology.
Yep.
And I had always thought I would do something surgical, and I hadn't decided which area of surgery I wanted to go into. And so, anyway, I decided to then emigrate to Australia. And to do that, you have to do work in an area of need as a doctor. So I had to work, look around to find somewhere that would take me and sponsor me to come to the country. And I ended up getting a job as a doctor in Quilpie.
Wow.
Yeah.
Going from one extreme temperature to another, quite frankly, isn't it?
That's exactly right. And I obviously, they said, oh, we've got a job for you in Quilpie. You've got to do 3 years there to get your permanent residence. And then you can, decide what you want to do or where you want to start. I didn't even know where Quilpie was. I'd never heard of it. Looked at it on the map, and I just thought it was just, out there in the middle of nowhere, truly in the true outback. And I arrived with a little bit of trepidation, but I had the most wonderful time with those 3 years that I was in Quilpie. I had a little general practice, and I ran a 12-bed hospital. I was the medical superintendent of the hospital, and you just kind of did everything. And the gardener was also the person that took the x-rays, and, everybody sort of multitasked. And I learned a lot. And I have to say that I made some wonderful friends with both the townspeople and the graziers there, who have been lifelong friends ever since. And I got to see a completely different side of medicine again. It was interesting, and learned a little bit more about things like Q fever and accidents related to sheep shearing. And so that was also a really good time. Very isolated. And I remember the first week I got there, two chaps arrived at my practice and said, oh, we've got a horse we need you to stitch, if you don't mind. And I was like, oh, okay. And I think they just did it as a test, to be honest. But they had a horse that wasn't broken in yet. And
oh no!
They just flipped it over on its side out on the hospital lawn, and the patient sat outside and watched as stitched its face up for it. So that was my introduction to Quilpie. And then during that time, I had to sit the Australian medical exams, and then I came back to. Well, I came to Brisbane, which was sort of closest, and I got some jobs at the Princess Alexandra Hospital, and that's where I was introduced to thinking a little bit about doing radiology as a specialty. And then I sort of realized that interventional radiology was a thing, because it wasn't that well known at that time. And I thought, that is amazing. That's something I want to do. And so that's how I started doing my radiology training, which was at the Princess Alexandra Hospital. And then when I finished that, and actually during my term at the Princess Alexandra Hospital, in the old days when we were training there, we got rotated to the Gold Coast for a 3-month term. And in my first year, I did a 3-month term at the Gold Coast, and it was still the old hospital before the new hospital was built. And I really thought, oh, this is an amazing place, and I want to live here and work here. And I asked for another rotation the following year, so I came down again, which was great. And the lifestyle of the Gold Coast was something that really attracted me, but also the people that I was working with. And so it always kind of stayed in the back of my mind. And then when I finished my radiology training at the Princess Alexandra Hospital, I had the opportunity to go and do a specialist fellowship at Mount Sinai Medical Center in New York, which is where I trained in neurointervention.
And I guess at this stage, we probably should explain what interventional neuro-radiology is, because it sounds rather daunting. So perhaps we should start there.
Probably a good idea. And when I started training, I didn't even know what it was either. And there were not many. It was just the specialty was still quite young. And that's because the technology developed sort of in the mid to late 80s. And it is a specialty of treating anything to do with blood vessels in the spine, brain, or neck, so arteries and veins, by minimalist sort of keyhole type surgery, if you want to call it that. So we treat anything to do with brain aneurysms, patients having acute strokes, anything that causes bleeding on the brain, blockages by blood clot, and there are other diseases that have like arteriovenous malformations, and it's all to do with abnormalities of blood vessels in the brain. It's a bit like plumbing, really, and so it is in a way. But you treat it using X-ray guidance. So, and you need a special angio suite where under X-ray guidance we can actually make a map, and the technology is amazing, and it has developed just incredibly over the years. Where you can inject X-ray direct contrast, and you can get this whole map, like almost like Google Maps of the whole area that you need to get to. And we start off by accessing either a small artery in your wrist or in the groin, and can use this map to navigate up into the brain with catheters, wires, stents, or coils, or whatever we need to use to treat it. And the arteries that we're working in are, range from about 4 millimeters in diameter to 0.5 of a mil. So they're very tiny. And the resolution that we have on these X-ray machines nowadays is that you can really zoom it up and you can see all this really fine detail. And the equipment that we have is developed to the point where you can guide it very carefully. If you imagine you're busy steering a wire to get to your location from outside the patient's body, it's going into an artery all the way up through the arm or the leg, up the neck, and into the brain, and then going around whichever corner you have to go to get to where you need to treat that. So that's basically what it is as a specialty.
So, a layman question. So, when you're going through the wrist or the groin, is it the same? Is it the same artery that you follow the whole way, or do you have to branch off to all the? Because
you've got to take all the twists and turns. Exactly right.
Okay.
So you might start in the artery in the arm, then you've got to go up around the big artery in the chest, which is the aorta near the heart, and then choose which one you have to go to. And yes, you have to take a lot of twists and turns in different ways. And that's why the imaging is so important, so that you end up in the right area.
Oh, absolutely. So you've been instrumental in establishing the interventional neuro-radiology service at the Gold Coast Hospital. And that's pretty well where this started, wasn't it? Is that correct?
Yes, well, yes. So I was very fortunate to have Hal Rice, who you mentioned earlier on, as a mentor and him and another one of my colleagues. And he had just come back from his training a couple of years before me and was starting to set up a neurointerventional service. And then I came and worked on the Gold Coast with him. And at the time, there really wasn't anything at all. In the days when we first started, we had to actually take patients up to Brisbane and do the treatment there at the Royal and bring them back down again to the Gold Coast, because we didn't have any of the equipment that we needed. So we had to do a lot of lobbying, first of all, to get the equipment we needed and to set up a service. And now, obviously, we've established a service on the coast, which we attract people from, North Queensland and all the way down to Coffs Harbour, really, and then we drain that whole area out west as well. So, and as well as visitors from overseas. So it started off just with us, doing our work and trying to do the best we can for our patients. And from that, we've managed to establish the Gold Coast as a centre where industry realizes that we've got a very reliable, good reputation. We know we get good outcomes for our patients. We've done a lot of research and we've published, and so it's allowed us to involve business as part of it on the side, which is what we'll get to later. But a lot of researchers and companies have come to us to maybe try a new device that might be really, really beneficial for a patient, but hasn't been tried before. And to be able to not only do this for our specialty, but to be able to offer something to a patient which they wouldn't be able to otherwise maybe have, be able to get done in this country or in the world until it gets a bit more established has been, a really great part of our service that we've set up.
So the centre, you essentially introduced cutting-edge technologies, didn't you, for the treatment of brain aneurysms and strokes? But your work attracted international businesses and industry. And I think it was very much around testing of devices and new devices and that whole morphing and the whole metamorphosis of how we treat brain aneurysms. Is that how it all came to fruition?
Yes, I think in the past, a lot of surgery had to be done by open surgery, where you used to have a craniotomy. So in the past, brain aneurysms, we'll start with aneurysm, we'll talk about stroke in a minute. Brain aneurysms, which is a weakness in a blood vessel wall, where you get sort of a ballooning out of the wall, which can rupture and then cause a brain hemorrhage, and obviously very serious for whoever that happens to. In the past, you'd have to have open surgery for this. You'd have to have a craniotomy. There were a lot of types of aneurysms that were not able to be treated because of where they were located, really deep in the brain, and those patients weren't even able to be treated. But what's happened with time and as the specialty has evolved, we've had these amazing devices developed and technology developed where we've found over time what works really well. And you can treat these aneurysms with different devices which actually block them off, or you can put a stent across the neck and it's minimally invasive. Patient wakes up completely fine and can go home 2 days later compared to being in hospital for a week. So that specialty has grown, and from absolutely nothing probably since the late 1980s to now. But on the Gold Coast and here at the Gold Coast Hospital, we have been very careful in seeing what's cutting edge research, doing our own research, and also making sure that we can get what we need to do something that's really at the cutting edge. And so we've been able to present this to our patients very early on. And, we've been able to treat conditions that were not treatable before, which is really amazing. The other thing, is that in the past, and this has changed significantly over the last year. So in the past, if somebody had a stroke, and by a stroke, I mean a blockage in an artery in the brain, and I'm sure everybody's known somebody that's had a stroke where you get an artery blocked and you may end up with paralysis down one side of the body, or inability to speak, or inability to understand. And it's such a devastating condition and so common amongst everybody. And in fact, when you think about stroke, you think about it only happening to elderly people, but at least a quarter to half actually happen in younger people. And so we see a lot of, a minimum 25% also happen to people, that are in their 20s, 30s, and 40s. And it's such a devastating condition, not only for the patient, but for their family, that can no longer earn a living. And so the treatment of stroke has changed amazingly. So in 2015, there were 5 trials that came out, and they'd all been done sort of together all over the world. And we were involved in one of them in Australia. And these trials showed that if you can actually go and get up into that artery and get the clot out and open up the artery as quickly as possible, you can reperfuse the brain, you can get blood going back to it, and you can actually prevent somebody from going on to developing a full stroke. And so now people have to get to hospital really quickly to get this done. And so there's a lot of work to be done in that area, but that has really changed the specialty and so much and these people's lives, because it's absolutely, changed the whole paradigm of having a stroke.
And I think that must be really recognised, because there's so much more information now on looking for strokes, what to look for in a person that potentially is having a stroke. So there's a lot of awareness coming through too.
Yeah, there's a lot of campaigning that's been done as a result of it, trying to make everybody aware.
That's
to
right.
Get to hospital quickly.
So technology has to be at the forefront of what you're doing. And what can you tell us about the impact of these technologies on patient outcomes in the healthcare landscape, I guess?
Yeah, so technology in my specialty plays a huge part. Um, the development of technology over time has absolutely changed patient outcomes. So in the past, so for stroke, for example, we didn't have the right devices to be able to get the clot out properly. And we used to try everything we could. We used to try and inject some clot busting drugs into the clot, and we had different kind of catheters and suction things that we could use. But there was the advent of a thing called a stent retriever, which was a device that was developed, which actually managed to help us grab the clot a lot easier. And that has absolutely changed everything. And being able to get catheters a lot more distal, which we couldn't do in the past, further deep into the brain, which we really couldn't do. And that's also technology has been the thing that changed that. And then treating aneurysms. In the past, even after open surgery, but when neurointervention became more prevalent, there were lots of aneurysms that we couldn't treat because we didn't have the right devices. They didn't work or they wouldn't work. And now we have the most amazing array of different devices to be able to treat different things. And there's nothing now that we can't really treat. It's almost, it's been amazing to see all these different types of things develop to be able to treat patients. So it's changed the outcomes for patients hugely along the way. And there's still so much more that's going to be coming in the future.
And that appears to have been in a very short time frame as well, hasn't it?
Yes. And there's there's definitely a lot of excitement around neurointervention and a lot of work being done, a lot of research being done to come up with new ways of treating and safer ways of treating patients.
So let's talk about NeuTex. You've since co-founded NeuTex, which is an image-guided therapy, surgical and robotics training centre right here on the Gold Coast. So let's start our conversation there. First, you recognise the need for it. So let's talk there. Let's start there.
Yeah. All right. So over the years, we have had a lot of specialists from all over the world come to visit us to train, but particularly from Asia Pacific.
Right.
And we run courses or we do various training workshops. And because of the amount of work we've done here, the reputation and the research, we have a very strong interest of people to come and learn how to use new devices or maybe learn how to treat a specific type of condition. And over the years, what's happened is we've been bringing them into the hospital to try and train. But as you can imagine, that's a hospital theatre. If an emergency comes in, you've got to stop the training. You can't say, oh, no, we can't treat the patient. So it was disruptive. And also it's quite difficult to have more than a very small group of people in an operating theatre at a time watching. And on top of that, we're also trying to develop devices and look at different types of, products and that we could be using or coming up with ideas. And we really don't have that space within a very busy clinical service, busy theatre. So that's where the idea of NeuTex came from to start with.
Mm-hmm.
And what it is it's an absolute replica of a theatre with a higher standard of equipment. And it is also has a lecture theatre. And what can happen now is we can have these groups of people who can watch us doing a procedure on a patient here at the public hospital, not in the hospital, but we actually have live streaming with lots of different cameras. They can see what our hands are doing. They can see what's happening up on the screen that we're looking at and how we're treating them. And then they can see how it's been treated. And then we can actually 3D print the exact replica of that patient's aneurysm or condition. And using that model, we can take it to NeuTex and they can practice doing the exact same thing in the exact same theatre environment. And it's very realistic. It's surprising because exactly what happens on the 3D printed model happened, in the patient. So I'm amazed.
Does it have the fluid going through?
It's on a pump that has fluid that goes through, and you look at it underneath that.
Absolutely realistic.
And they do it up to sort of body temperature to make it, and the same viscosity of blood and the thinness of the walls of the arteries, which are very delicate. So So then, and the other thing is then they can also bring a scan of one of their patients and say, oh, we'd want to treat this, and we can 3D print that up. And then they can say, all right, well, let's try this, let's practice that. And then they can go back and then treat their patients after having had, almost the same real life experience with what they're going to have when they go back. So that's the one segment of NeuTex. And then the other part of NeuTex is the research and development part. And we're using that to look at and test different new devices, look at new ideas, 3D print devices, and then see how they might work. And also looking at robotics and how that will be integrated with artificial intelligence as well.
So what sets NeuTex Centre apart from other training facilities in the world, and how does its state-of-the-art equipment enhance those training experiences?
Yes, and so the main thing that's different from elsewhere is actually the equipment that we have.
Okay.
It is absolutely the best you can get. And most of the training centres elsewhere have, sort of little kind of X-ray cameras or fake X-ray cameras they don't actually have. They just use lights and try and look through clear plastic. So it doesn't replicate that exact experience. And I think that's one of the main reasons that sets NeuTex apart. It is exactly like a replicated theatre.
So
and also it's on the Gold Coast.
Yeah, exactly. But so that's where that 3D comes in, isn't it? Is that the defining difference, the 3D, the ability to do the 3D?
Yes. So you can do that on the angio machine that we have, which most of the other centres across the world don't have that. Yeah.
Wow. So can you share an example of how the training centre has already benefited clinicians?
Yeah, so we've already had several workshops. We've had people come from Asia, who don't really have a lot of experience or exposure to certain devices that we have. And so it's directly benefited them in that they not only have they been able to learn how to use them, but they've gone back and treated their patients, and they've gotten back to us and gone, oh, just letting we did this, we treated this patient, it went exactly like we thought it would, thank you so much, it's worked so well. And so not only has it made a difference in their clinical work as a day-to-day basis, but it's made a difference in the lives of the people that they're treating as well.
Is there a big difference in the time frame of treating a patient now as opposed to, say, a few years ago? So I was thinking technology's changed so rapidly, and now you've got the benefit of this state-of-the-art technology. Has that really impacted on the time that patient's actually in recovery or that in surgery?
Absolutely. So we've gone from taking 2.5, 3 hours or longer, sometimes even really long 4-hour surgeries, to now take half an hour or 20 minutes, so much quicker. So the actual surgery itself has changed, but the recovery has been so much better as well. So patients now, if you can imagine, takes 20 minutes to put a stent in, you just wake up, it's done. You completely wake up normal. You've got no, scars on your head. You've got no stitches or anything. You can't even see where we've been in. And it means people can get out of hospital so much quicker. We tend to keep patients in just for a day or two afterwards, just because we want to make sure they're okay. But some people could actually leave, sooner than that. So it has absolutely changed both the theatre time and recovery and the patient's recovery.
Yeah, absolutely. So what's the benefit now? You're out at the Gold Coast Health and Knowledge Precinct. What's the benefit of having NeuTex in close proximity to the hospitals?
Well, there are a few things. So first of all, at least we're able to live stream cases from the hospital. So it's really a live, true life experience. And being close to the hospital has made that really a lot easier than sometimes you can have some difficulty with technology. So having it not to stream too far has been really good. But I think the thing that's most important is the collaboration of having it at NeuTex. And NeuTex is not just for neurointervention. It is also for all types of other image-guided therapies. And we're doing some spinal workshops soon, some orthopedic workshops. We're also have cardiac printed models, and we're actually having a cardiac, so that's, structural heart surgery that's also done endovascularly. We're having a big conference at the Gold Coast Hospital coming up in May sometime, and that is going to then they're going to be able to use NeuTex as well to look at devices and to train people. And so it is definitely the hub of where it is, not only just in correlation with the hospital, but also with the Health and Knowledge Precinct and with Griffith University. And what you have when you have different areas coming together, you suddenly see that you maybe something is possible because you get somebody else's point of view who's working at it from a completely different, kind of perspective. And so it breeds this collaboration. And so it's not only beneficial, for research, but it in the long term benefits patients.
So interventional neuro-radiology is an ever-developing field by the sound of it, and there's always new technology coming out. So how has that field of neurointervention evolved since you began your career?
Well, when I first started, we had literally one type of device that we could use, which was called a coil.
Really?
And we also, and it was, I remember the first time I saw a stent, which is like a mesh tube that you can put across an aneurysm neck. And I was just blown away. I was like, oh, this is so amazing. And that was about probably a year into my training. And now it's changed. So the technology over time has changed amazingly. Also, in the old days, it used to take quite long to detach a coil. So if your coil is like it's almost like a slinky that it's got a preformed size and shape, and when you put it into an aneurysm, it fits the aneurysm completely, but you had to put it there somehow. So you've got to be able to detach it so that it can stay and you can pull the thing out that you put it there with. And in the very early days, it used to take a long time, up to 30 minutes to detach a coil, whereas now it's instant. That's so not only has that changed as far as time goes, but the finesse of what we can use and the amount of technology available has changed massively. Also, what's changed is there's actually been an awareness of the specialty has grown hugely over time, which has also been very beneficial for patients. And one of the biggest changes has been in the treatment of stroke. And it's become a multidisciplinary system now where everybody's involved along the way, whereas before we might have said, oh, we can do that, but now we have people right from the public who are becoming aware that you need to get to hospital quickly, to the ambulance person that comes, to the ED physician, to the neurologist that's involved, and to us. So it has really developed massively over time. The other things that have changed is when I first started neurointervention, there was only one other girl in the whole of Australia, one other woman, and she was literally 1 year ahead of me. So the two of us sort of started together. She was in Adelaide, and we're still only less than 10% women in our specialty, but it's changed a lot. The women are becoming more involved. They're feeling a little bit braver to have their voice heard. And they're definitely stepping out there across the world, doing more. So that has changed too over time. It's going a little slowly, but it's still going. So it's good.
So that whole recognition of that field has gained more recognition, I guess, hasn't it? I mean, I think that years ago it probably wasn't at the forefront of career choices.
No, absolutely. And to start off with, a very few people realized it was a career that you could actually go into, but it's now become such an important and integral part along across so many diseases that people are very much aware of it now. And it is also seen as a very exciting specialty because it's so technology dependent that a lot of people are being drawn to it to train.
Yeah. So looking ahead, what emerging technologies or trends do you foresee that will shaping the future of interventional neuroradiology? And And I guess twofold, how do you stay at the forefront of those developments?
Yes,
Yeah.
I think that there's going to be a lot of development in the AI space,
Right.
looking at it. And it's going to be really amazing. So at the moment, if you think about it, when I'm treating a patient, I have my years of experience and what I've read and what I've seen. But that's, and, experience that other people have passed on to me. But if you can imagine somebody having all the AI of everybody's experience over time and having that integrated into how you would work out how to treat something. I think AI is going to be very useful. I mean, medicine is science, but there's a little bit of art to it as well. There's definitely art. So that will always be there. And you'll always need the, the finesse and the decision of the individual person treating somebody. But I think artificial intelligence is going to be really useful in saying, all right, we have this that looks like this, and it's this shape and this size. This is going to be the best way to treat that. And it will be from the vast experience of thousands of people that have treated or have been treated. So I think that's going to really play a part. And I've already seen it, in quite a few prototypes that are coming through. And I think robotics as well. Now, robotics in surgery is not new. There are quite a lot of robotic assisted other types of surgery. But in our field, robotics is very new, particularly because the work that has to be done is so delicate and so fine that to make a robot that's can do that very, very fine work has been quite difficult. And even the first robot that we were very fortunate to get access to here on the Gold Coast, which was made in America, it was wonderful to be able to use it, but the technology needs to improve. And so I think robotics is going to be combined with AI. And where I really, really hope that this goes is people that don't have access to neurointervention in the bigger cities, because it is very technically dependent. So you have, good centers across the cities in the country, but not in the rural areas and not out in the smaller towns where it takes, if you think about somebody having a stroke, you lose millions of neurons every minute. And so the longer it takes to get that patient to a place to be treated, the worse their outcome is.
Mm-hmm.
And so if we are able to, in the future, with AI and robotics, treat somebody in the center where they are without taking the 5-6 hours to transfer them to us, I think we're going to be able to get a lot better outcomes. So I do think technology is going to go in that area as well. And I've seen AI being used, little prototypes coming out of different ways. It's also just helping physicians, with little ideas or warnings. So I think there is so much more, and there's the technology as far as the actual device types we use are changing a lot as well. And as far as staying ahead and keeping up to date with that's the fun part of my job. So I like to be involved at that cutting edge of technology. And I think one of the most important things is to be a collaborative colleague with people everywhere in the world. And when people are excited about something, we tend to get together and talk about it. And so it's very important just to be in that environment where that what is new might be coming out. And then also not only that, but you want to be the one that's coming up with ideas, but also willing to help test, put in the extra hours, willing to help different companies look at things and develop things. So hopefully be able to stay at the cutting edge, but a lot of it's pretty fast moving. So we'll see.
So what are the goals and aspirations for the future of NeuTex in NeuTex Training Centre? You've mentioned aneurysms, you've mentioned stroke, but you also mentioned spine. So is it that expansion piece? Is it that you will be able to treat more issues in people? Or
definitely. So the next step. So we're already starting to branch out into other areas, which was always the intention. But what we wanted to do was start off first with neurointervention, because that's our space that we know so well. And now the next step is to bring in all the other types of specialties that need training, and just as much as neurointervention does. so does somebody treating an abdominal aortic aneurysm or leg artery problems or, orthopedic fractures or being able to cut out tumors. So all that kind of thing can now be done at NeuTex in a center where everything can be 3D printed. And the long-term goal is to try and one of the long-term goals is to try and get 3D printing to the point where we no longer have to use, cadavers or animal models for any training. It's not quite there yet, but we're getting there, which is, really good. There's some really interesting stuff along the way. And then finally, that's the training side of it. But the other side of it is definitely the development side of it. And so the product development and the research. And NeuTex is going to be absolutely integral, and that's going to be its really longer term project as well. So on the one hand, training, but in the same time, doing a lot of testing and a lot of product development as well.
And certainly AI plays a major role, I guess, in that future for NeuTex as well. That
Definitely
would have to. So as someone who's worked in various healthcare settings globally, what unique perspectives or lessons have you gained from those diverse experiences that have influenced your approach to your patient care?
Yes, I think I've been fortunate to work in a lot of different health systems. And I will say right from the beginning that we are very fortunate to be living in Australia as far as our healthcare goes. We have an excellent healthcare system, both in public and private, and having that dual public and private system actually works really well. I mean, it's not perfect, obviously, we have lots of issues, but compared to a lot of other countries, we're doing pretty well. And if you are really unwell, you will get the highest standard of care. So that, that was something that I really realized when I first came to Australia to work. But I think having worked across a lot of different health systems, it does give you a sort of a more global look at and perspective of things. And in the end, the main thing is that everybody wants to have the best outcome for their patient. And at the center of all of this is that person that needs something done for them or some treatment. And in each place that I've worked, that is definitely we all have the same goal. And that's what we want. But having said that, it's very different to working in, a crazy emergency department in South Africa where there are lots of patients that need, instant attention, but they can't get them because too many patients compared to doctors, to in the system in the US, which is obviously a completely different system. But it does give one a perspective on what is possible and how it's really important that everybody has their own strengths and their own weaknesses. And if we all work together and collaborate, we can actually really achieve a lot.
So you're also an associate professor at Bond University School of Medicine and involved in teaching medical students, allied health professionals, radiology trainees, and other medical specialists from here in Australia and overseas. So balancing clinical practice, research, entrepreneurship, and education can be demanding. So what strategies do you personally employ to manage your time and success, I guess, ensure success in all those aspects of your professional life? You've got a lot on your plate. I'm tired thinking about it.
Yeah, it's really tricky. And I have had to learn over time. It didn't come entirely naturally.
Yeah.
I think one of the things personally that I do is to unwind is exercise. I really couldn't live without that. And so really, even if it's just a run or a walk or going to the gym or getting out on the water, that really helps. And even if you can just for half an hour a day clear your mind and just concentrate on that, or an hour, I think that has helped a lot over time. But as far as trying to manage time, I have had to learn to delegate a little bit over time. And I found quite difficult, especially when you're so involved. And, at the time when we were setting up Qscan and looking after every element of it and every, part of looking after our staff and deciding what equipment to buy and building a clinic. And it was very busy and very fulfilling. But over time, you have to realize that you can actually maybe delegate that decision to somebody else and they will do a really good job. And so But that was something that I had to learn over time. So that actually, this bit you don't need to do. You can give that to somebody else to do. And I think another really important thing is surrounding yourself with supportive people.
Perfect.
And colleagues that really support you, and family members who support you. And that really helps when those times get so crazy. You can actually have people that can say to you, look, you'll be fine. Just take a few minutes to breathe. We'll get there. Take some time. And that has really helped me over time as well. But it is a juggle. And I think you get better and better at time management as you get older, I hope. And you tend to you tend to not waste as much time as you may, or you just become more efficient, I think.
I know, and time is precious, isn't it? I mean, I realize it's so precious.
Every minute
is precious, particularly the down times. So you're now living on the Gold Coast, and my last question, and it's been wonderful speaking with you. Why the Gold Coast? Why did you make it home, and what is it about the Gold Coast that keeps you here, apart from your incredible work you're doing and the colleagues you're working with?
I think we're so lucky to live on the Gold Coast. It is a wonderful place to live, and that was definitely what attracted me to the Gold Coast in the first place. When I was busy training in Brisbane, I used to find myself driving down to the coast a lot on the weekends. And I was saying, it's much better just to live here. And so there's definitely lifestyle. We're very fortunate. We have a wonderful community. And we really have the world's most wonderful beaches. We're so lucky to live here. And we're lucky that we have this outdoor lifestyle where you can decompress if you need to. And what's been wonderful since I've been on the coast is to see how it's developed. It really is developing, and it's an exciting place to be. And I like it because it's very cosmopolitan. I like it because there's a lot of interesting people. And the fact that, we've started off as a little tourist city, which has honestly grown into a multifaceted city where tourism is amazing. But we also have other facets, and we're in business and research and science, and there's so much happening that it is really a wonderful place to be able to work. And you don't feel as though you're being deprived working here at all, because you have everything that you need and people that you need and contacts that you need. And at the same time, we're so lucky to live where we live. So that's why I ended up here.
We still have the best beaches and the best climate, really, out of everything.
Definitely.
And some good restaurants.
Definitely. Yeah.
I was going to make that the last question, but I will make this one the last question.
Okay.
I expect, what words of advice or wisdom would you have for young girls hoping to look at their career and moving forward?
I think, we are fortunate because we had so many people that trailblazed before us, women. And so the pathways have become a lot easier. It's never, you're always going to come up against some kind of discrimination as a woman. You can't let that get to you. And what I think most, girls these days are aware of, and it's been great, is that you can actually chase your dreams. And what I would say to most girls is really decide what you want. And once you've made that decision, commit yourself, and you will get to where you want to be. You absolutely will. And there's often things along the way, it's not all roses, where you might feel discouraged. But make sure that you have somebody that's a good mentor that you can talk to and get you through those times. And make sure that you don't lose sight of what's fun. Like, you don't want to be doing something that you're not enjoying. Make sure that you love it.
Yeah.
Because what's the point?
Exactly. Look, thank you so much. It's been absolutely brilliant speaking with you. We're so lucky to have people like yourself on the Gold Coast that are just, making great moves globally in your field and also helping us as patients. So thank you so much for taking the time out of your busy day.
Thank you. It's been absolutely lovely talking to you.
Thank you. Thanks for listening today. For a complete list of podcast episodes and transcripts, go to rdagoldcoast.org.au/podcasts. And don't forget to follow us on Facebook, LinkedIn, or Twitter.